A patient once asked me something very reasonable. Doc, how can my surgery cost this much if you don't get paid that much? It's a fair question. Most people assume the surgeon makes most of the money. If we go line by line, that assumption collapses. This isn't about blame, it's about following the money. So, what patient sees? After surgery, patient receive a large bill, a multi-line items, number that feel arbitrary. So the natural conclusion is someone here must be making a fortune. But here the first thing no one explains. Your bill shows charges, not payment. Very important. Those are not the same thing. So charges versus payment. Let's talk about the illusion here. Hospital post inflated prices called charge master rate. Almost no one pay them. Insurance negotiate them down. Patient never see the final math. The bill shows what was charged, not what anyone actually received. That gap hides inefficiency and protects confusion. So let's start with the surgeon. Paid a fixed professional fee set by Medicare or insurance. Same pay whether the case is easy or hard. And this is an important truth I want you to know. The surgeon's pay is usually the smallest slice of the pie and the only one tied to personal responsibility. One complication, one lawsuit, one bad outcome, same pay, often after office overhead, staff salaries, malpractice insurance, call coverage. In many cases, the surgeon doesn't just earn less, they subsidize the system. So let's talk about the hospital, the big number. This is where costs explode. Hospitals bill for operating room time, facility use, nursing staff, recovery rooms, equipment access. This is the facility fee. And this is the key truth. The hospital makes money for owning the building, not for performing the surgery. Same surgery, same surgeon, different hospital, radically different price. So ownership matters. Hear what rarely said out loud. Hospital is often the owner of the facility, employed physician groups, imaging centers, labs. So money circulates internally, appears at separate charges, disappears into the system. And remember this. When one entity owns multiple steps, money moves invisibly. Anesthesia. Now let's talk about the anesthesia. It's almost always a separate group, a separate contract, a separate bill. Patients often never meet themselves, this anesthesiologist beforehand, but they meet the bill afterward. No bundling, no predictability. So now let's talk about the device supplies, how it works. This include implants, disposable tools, single-use device, and this is the uncomfortable truth. The same device can be built at wildly different prices depending on the facility. Not because it's better, because it can be. Pathology, lab, and imaging. Often billed later, pathology reads, lab processing, imaging interpretation. So frequently out of a network, as we all know, poorly explained, impossible to estimate in advance. Small individually, but massive together. Here it comes, the insurance, the invisible player, negotiates prices, decides network access, control reimbursement. So this is the key distinction. Insurance does not pay based on cost. It pays based on leverage. Hospitals have leverage, independent surgeon don't. So what happens when there is complication? And this is the critical mismatch. Complications increase hospital revenue. Longer stay equal higher facility billing, more imaging, more lab supply. But for the surgeons, pay stays the same. The liability increases. I would like you to pause and think about this with me. The only person financially punished by complication is often the surgeon, not the system. That's not how incentive should work. And this is the logic gap. So let's summarize this and talk about the contradiction. The bill is massive. The per surgeon's pay is fixed. Responsibility sits with the surgeon. Yet, the person with the most responsibility controls the least money. That's not normal in any other industry. So, how about let's talk about cash versus insurance, the awkward truth. And this will surprise many patients. Cash surgery often costs less. Same surgeon, same surgery, same outcome. Why? Very simple. The more intermediaries involved, the higher the bill, even when nothing changes medically. So why this system persists despite all what we said? This doesn't continue because accident or by accident. It's a complexity discourage questions. Patients blame doctors. Doctors are contractually constrained. System benefit from opacity, and this is the simple truth. Complexity isn't accidental, it's protective. Let me be clear, this is not anti-hospital, anti-insurance, anti-medicine. It's pro-transparency because confusion protects inefficiency. So what patient can do? My recommendation. Before surgery, ask 3 questions. Which part of this bill do you control? Is there a facility alternative? What charges the prices and what does not? Clarity restores leverage. I am not saying anyone is evil. I'm saying the money flow doesn't match the responsibility flow. And when patients don't understand that, they cannot make informed decision. Clarity doesn't attack health care. This is Dr. BenMaamer. Follow to help build momentum to fix healthcare in America. And if you have something that you can add in the comment, that will help me sharpen the message.